Hi, I'm Dr. Steve Myers, and I'm here with my patient Kathy, who is about 10 weeks out from a bilateral knee stem cell procedure. Before we talk to her, we're going to take a quick look at her x-rays and see what kind of issues we were dealing with. Okay, so looking at her knees, this is her more symptomatic left knee and her right knee. If we take a quick look at her right knee, as we zoom in, you can see good amount of dark joint space. This is the cartilage thickness in the joint. She should have the same amount of thickness on the inside of the joint where she's got a lot of loss of the joint space, loss of cartilage. We call that arthritis. Looking at the more symptomatic left knee, you can see further loss of joint space on the inside of the knee where she's lost a significant amount of the dark joint space, along with a big bone spur on the outside of the knee, above and below the joint space. Okay, so thinking back to before procedure, describe your symptoms with your knees. What kind of issues were you having? What kind of trouble were you having with both of your knees?
I was having issues walking, had to walk with a cane. I was not able to walk unassisted, could not go up and down stairs. It would wake me up at night with my knees hurting.
And what kind of treatments had you had before we discussed treatment options?
I had not had any medical treatments. I had done a few exercises and that sort of thing, but I saw no change.
And why ultimately did you decide to go through stem cell for your treatment?
I had a friend who heard your lecture, and she advised that I ought to check into it and call and talk to your office, which I did. And then we made the appointment to come in, and once we talked with you, the decision was easy.
Thinking back to the day of the procedure, how much pain was there as far as getting the cells and doing the injections?
There was not pain, there was pressure. I could feel the needle when you were numbing, and then also when you were collecting the cells, but there was not any pain.
And so here we are 10 weeks out from procedure. How are you doing?
I'm doing fabulous. I have no pain in either knee. I walk unassisted. I can go up and down stairs. I can get in and out of the pool. So it's just been fabulous.
Compared to before procedure, 10%, 50%, 80, 90, 110% better? Give me a number.
It's 110% better already. And I still have a month to go.
Having been through it, here we are 10 weeks down the road. Do you feel like you made the right decision with your treatment?
I most definitely did.
Well, thank you so much for coming in, and I appreciate you coming in and talking to me, and I'm so glad to see you're doing so much better.
Well, thank you. I really appreciate what you did for me.